So today with us we have, and you guys wave when I call your name, Alex Pearson, who a lot of you folks know because she spends time working with the hospital staff, Angela Weber, and Nicole, Wilepski. And my last name is Winkowski, so I should have gotten that easy. But they're going to be here today to provide information on medical assistance, give you a basic overview, and answer any questions you might have. So can we start them off with a really warm welcome?
Okay, so I'm here. I'm Angela Weber. I'm the new supervisor for the Family Investment Long-Term Care Unit. We are here, and we'll just get started. The community medical assistance. Community medical assistance for non-Medicare recipients under the age of 65 have to apply through the Maryland Health Connection. They cannot come and do a paper application in the agency. It has to be done online. If they want to come into the agency and complete it online with us, we can do that. But if they do not have Medicare or if they're not disabled, they must go through the Maryland Health Connection. If they are a Medicare recipient, they could be eligible for a QMB or SLMB that pays their premium, and the QMB pays the extra 20% that Medicare does not cover. They apply through us at the local DSS. They can do that online, in person. They can mail in the application if need be, but that is how they have to apply if they're Medicare recipients. They do not get Maryland Health Connection. The income limits for Community MA, Maryland Health Connection, it's based off your household size. So if they're married with 3 kids, we look at a household of 5. If it's just one single adult, we look at $16,643. That is gross. If they bring home more than that, they may not be eligible for medical assistance. Now for Medicare recipients, the QMB, again, that pays the extra 20% that Medicare doesn't cover, and that also pays their premium, so they don't have to pay that any longer. The maximum for one person that they can make gross is $1,025. If they make over that, they could be eligible for something called the SLMB, which just pays the Medicare premium for them. It does not pay the 20%. And they can make a, I'm sorry?
Is that per month?
Per month, yes. So if they make more than that $1,226, the only other option for Medicare recipients is something called a spend down, which is basically a deductible program. They are required to pay the first amount of their spend down. Once they reach that spend down amount out of their own pocket, then the state of Maryland will pick up for the remainder of that 6-month cert period.
Are these numbers similar to other states, or is this specifically Maryland?
Can you repeat the question?
The question was, are these similar to other states, or this is just the state of Maryland? Does anybody? It's just the state of Maryland. Each state does have different qualifications. Yes, ma'am.
Could you explain the spend down a little more? How do they spend down? Is it like 6 months of bills over a certain amount? Can you explain that?
Okay, she asked us if we could explain the spend down a little more. The spend down is basically, let's say they make $1,000 per month gross. They're allowed to make up to $350. So their spend down amount's going to be, what is that, $650 per month for 6 months. So $650 for 6 months, do the math. I can't in my head. But it's basically, they have to reach that amount of bills before the state of Maryland would kick in. So they would have to start paying down that amount of bills.
So depending on what they spend down amount is, say for instance, they spend down amount is $2,000, okay? They have to meet that with medical bills. And if they have a bill that's $3,000, they'll need it. The $2,000 the customer will be responsible for, and that $1,000 Medicaid will pick up thereafter up until the end of the 6th month. There's only a 6-month consideration period. So it's based on the income. So we look at the gross income. We minus the $350, and they also allow a $20 disregard allowance. So you're looking at $370. So subtract the $370 from whatever their gross income is, multiply that by 6, then you get the spend down amount. So then you can use medical bills within the last 12 months. But with that, they have to have a current statement date. So say, for instance, they was in the hospital December 2016, and they applied this month. We have to see a current bill with a current statement date within the last 30 days before we can use it. If not, they cannot use that bill towards the spend down.
Are those bills period or bills they actually pay out of their pocket?
You can use bills that you have, well, put it this way.
Like a
You're
hospital.
still responsible for whatever bills that you have. So say for instance, you have a bill and you've been paying on it, you can't use that bill. If it's a bill that you'd already paid, then no, it's not.
I mean, that say Medicare paid, if the bill
The
is.
20% that the customer will be still responsible for, you can use that bill, but we have to see it after Medicare has already paid the 80%. Oh, I'm sorry.
Any other questions on the income limits before we move on? Yes, ma'am. Okay, you first.
Is it just medical bills, or can you use durable medical equipment for the spend down?
The question was, can you use bills or durable medical equipment?
So are you speaking of a bill that you received for like a wheelchair or something like that? You can use
Or a
that.
hospital bed?
Yes, you can use that. You can use even your receipts from the pharmacy. You can use that as well. So any bills that you have, like I said, within the last 12 months, as long as it has a current statement date, you can use towards the spend down. But whatever that spend down amount is, as Angela stated, it's like your deductible. That's the amount you're responsible for. So any bills you use towards that spend down, you're still responsible for. But those bills aren't getting paid. It's just help you meet your spend down, and thereafter your Medicaid will pick up until the end of the 6 months. Sometimes with spend downs though, a lot of people, because of their income, they may not even meet their spend down. They may meet it the 5th month, so you only have that 1 month, and then you have to reapply. It's only for 6 months. So a lot of times the spend down, especially with our Social Security recipients, they very seldom meet their spend down. I think they had a question.
There was somebody up there that had this.
Harford Memorial, you had a question?
Yes, I did. So under, on the page that says community MA income limits, the left side, the American Health Connection, is for people who are not on Medicare. The right side is for people who are on Medicare and applying for Medicaid as a supplement. So the Medicare people can have or have lower income limits than the Medicaid, correct?
The question was,
It's a different, pardon?
No, go ahead,
Okay.
continue.
So the income limits are different whether you're on Medicare compared to not being on Medicare is what I'm saying.
Correct.
They're different income guidelines, correct?
Yes.
Correct, they can hear it. Did you hear me? That is correct. So the community, the income guidelines that's to your left, that's underneath the Maryland Health Connection, those are the income limits for the recipients that does not have Medicare and are under 65. So if you're under 65 and does not have Medicare, you must file through the Maryland Health Connection. And if you are above the income limit that you see, then you would have to purchase a QHP, a qualified health plan. So you won't be able, you will have to purchase that to get your health insurance. But the recipients on the right are the Medicare recipients. And with the guideline for a single person, if your income is above the 1,025, you're going to trickle to a SlimD, and that's only going to cover your Medicare premium. QMB, if you're within that guideline, it will cover your Medicare premium, your co-pays, and your deductibles.
Correct. So the income limit for Medicare is lower than it is on the other side. for Medicaid.
Correct.
Because that 1,025 is only 12,300 a year
That-
as opposed to 16,000.
Correct. You are correct.
Okay.
any other questions about this slide? Long-term care. That's for people in nursing homes. They're intending to go into a nursing home. They're not intending to go home within the last 30 days. So long-term care is for people in nursing homes for at least 30 days or more. If they need to go into just rehab for 30 days or more, fill out an application. Income for long-term care. We look at all gross income. We don't look at net. We don't allow deductions for the taxes being taken out. We don't give deductions for child support being paid. We look at all gross income. Deductions, they do get, actually it changes to $78 next month, but $78 or $77 currently. Personal needs allowance. They get they get a deduction to pay any supplemental health insurance. You must provide proof of that, and they get a spousal allowance or a family allowance if applicable. Total gross income minus applicable deductions gives the monthly cost of care. Any questions?
What's the, how much is the spousal allowance? Like, what does that take into consideration?
That takes into consideration the spouse's income and shelter expenses.
Okay.
It's determined on a case-by-case basis. There is an example later on that we can go through.
Okay.
But that is a case-by-case basis. Now, if the spouse makes a ridiculous amount of money, they're not going to be eligible for a spousal allowance, probably. Any other questions about that? No hands? Yeah, the spousal allowance is determined once the eligibility is determined. It's not done during the application process. It's done when we're actually finalizing the case. For a single, yes, ma'am.
I'm having trouble hearing.
I'm sorry.
Thank you.
Okay. So do you need me to go back?
No, I just need you to ramp up the volume.
Okay. The asset limit for a long-term care medical assistance case is $2,500 for a single person. That is not if they're married, but if they are a single adult, they are only allowed to have $2,500. This includes all checking, savings, IRA, life insurance policies, stocks, bonds, CD accounts. Anything you can think of that might possibly be an asset account, we count it, we look at it. We verify the balance as the first moment of the first day of each month, or the month of application. Does anybody have questions about that?
You said that this is an asset for long-term.
Long-term care. Yes. Yes.
This includes Social Security.
Yes. It does include Social Security. Yes.
I've heard that there's like a time limit on how far back certain things are looked at. So if people move things within a different time period, so it's like not in that person's name.
Right.
So what is that time period, and tell me more about that.
The question was, what is the time period for the look back period? We look back a full 5 years in most cases.
Okay.
There are rare cases where we don't have to. However, most cases, we are looking back the full 5 years. So anything they did in 2012, if they gave $20,000 to their child, we look at that.
Okay.
If they did anything within that 5-year look back, we look at all bank statements for all months, and we look at it.
But if they did it in 2011,
We'll never know.
Okay.
Or if
The look back period begins the month in which they apply. So if they apply this month, we're looking back June 1 of 2012.
Okay.
So if they gave that $20,000 in May, we don't even worry about it.
Okay. Thank you.
Any other questions? Looking at the TV screen.
No.
Okay. Nicole? Alex.